Quebec is reporting a case of something you may not have heard of before, Rocky Mountain spotted fever. We're looking at ticks in these images because it is a tick-borne disease, but it's not Lyme disease. Again, it's called Rocky Mountain spotted fever. There's a piece up online talking about it, something new. But when we talk about something new, you know, and particularly along this line in medicine, Dr. Isaac Bogoch is so helpful to us. And he's with us this morning, infectious diseases expert in Toronto. Good morning, Dr. Bogoch.
Morning, Heather.
How many times have we talked about ticks and Lyme disease, but it's something totally new today. So Rocky Mountain spotted fever. What is it?
And this is a tick-transmitted illness, as you mentioned. There have been very few cases in Canada to date. Those have been in British Columbia. But Ontario started to see this infection pop up in dogs in the southernmost part of Ontario. And now most recently, there is probably a case in Quebec. The interesting thing about that case in Quebec is that that individual might have acquired it in Ontario. So it's not entirely clear where that case was acquired. Having said that, this can be a very serious infection. On the spectrum of illness, Rocky Mountain spotted fever can be rather severe. Interestingly, as the name implies, you think it would occur more in the Rocky Mountains. It actually doesn't. Most of the cases occur in the southeastern United States, but they do occur north of that. And as we see, shorter winters and less cold winters, the ticks that can transmit this can survive and thrive in more northern latitudes. And sadly, it's not surprising that we're going to start seeing cases of this appear in Canada.
So interesting, the name Rocky Mountain spotted fever. The Rocky Mountain part doesn't really apply, but the spotted fever does. In terms of symptoms, spots, fever, this is all part of it. Take us through the list of symptoms here if you've been bitten and are developing this.
Yeah, so after a tick bite, there can be an incubation period around about a week or so. And then people will have non-specific symptoms, fever, headaches, muscle aches and pains, fatigue. Very difficult to distinguish that from many other illnesses. But around the third day of illness, you can develop this rash. It's called a petechial rash. As you point out, it's got these spots that can appear. And again, like most illnesses, there's always a spectrum of severity. But with Rocky Mountain spotted fever, along that spectrum of severity, it's not surprising that some people are on the more severe end of the spectrum. So many people will feel unwell enough and present to hospital, and it can cause organ failure. Pick an organ and make it fail. It can cause central nervous system problems, heart problems, liver problems, kidney problems, big time vasculature problems, and people can get very sick from this. And that's the key point here, is that for starters, it's extraordinarily rare. But we know it occurs. Second thing is prevention is key. We should be outside and enjoying our summer as much as possible, and then just take steps to prevent tick infections. But the third thing too is it's not hard to treat. It's an antibiotic that treats it, the doxycycline, which is a commonly used antibiotic, and we have it in Canada, of course. But prompt treatment is very important for this. So it's important for frontline healthcare providers and public health specialists to be aware that there are emerging tick-transmitted illnesses in Canada. Rocky Mountain spotted fever is but one of several of them, and this one can be on the more severe end of the spectrum. We should be aware of it so we can prevent it, but also promptly identify and manage it to avoid complications.
Okay, we've covered the symptoms. We've covered the need for prompt treatment, that there is treatment that is readily available, the consequences of not being treated, how dangerous and even deadly it can be. Just one last point, Dr. Bogoch, because you mentioned prevention. Obviously, we want to be outside heading into another summer weekend, last ones of these summer weekends ahead. So what is the advice, though? What are the precautions to take?
Yeah, step one is enjoy the out of doors as much as possible. It's so healthy for us to be outside. But of course, long pants and a long sleeve shirt are very helpful. They're not perfect. And of course, it's not practical when it's 40 degrees outside. But insect repellent also can be very helpful. And then when you come inside after being out of doors, a tick check. Just look at your body, look at your skin, make sure there are no ticks there, and promptly remove ticks that have found their way to your body. It's also helpful to have someone look on the back of the legs or on the back where you can't see very well, and just to make sure there's no ticks there as well. again, we'll have a wonderful summer and enjoy the outdoors as much as possible.
Thanks, Dr. Bogoch. Really timely and really important new information to share. I always appreciate it.
My pleasure. Thank you, Heather.